So what, we get drunk. So what, we smoke weed. We're just having fun. We don't care who sees. So what, we go out. That's how it's supposed to be. Cause you know I'm high as fuck. Young and wild and free. So what? I keep them rolled up, sagging my pants, not caring what I show. Keep it real with my niggas, keep it playing for these hoes. It look clean, don't it? Watched it the other day, watch how you lean on it. Eat me some.
Hello everyone, welcome to the second part of Cannabis and the Mind. A short recap. So in the previous episode, I was telling you all what cannabis is and the extent of the problem of cannabis dependence. I'd also started off with a case that I had come across during my residency days, and I was describing you all about amotivation syndrome. In today's episode, you'll be getting to know what are the other symptoms caused by cannabis. I'm also going to discuss about the myths associated with cannabis use, and finally the treatment aspects. Do watch this episode. The friend who came along with this patient also reported that he used to talk to himself and also mutter and sometimes laugh to himself. The patient also admits that he could hear some voices, and when he looks around there's nobody. So that was a hallucination. And he also had this belief, this strong belief that somebody is trying to harm him, somebody is trying to attack him. And he would make sure that he's safe in his hostel. So these are the symptoms of paranoia, which can also happen with constant cannabis use. It's hard to say if all the patients develop these symptoms. However, my patient here, he had these symptoms called as psychotic symptoms. And this was a diagnosis of cannabis-induced psychosis. Next what? So there are many other patients who come up with other symptoms. It's not just amotivation syndrome or psychotic episodes. Patients can also develop mood disorders. Patients can develop insomnia and cannabis dependence per se. Now, coming to the most important part of the topic, myths about ganja, myths about cannabis. A lot of people debate and argue that ganja is good for me. Lord Shiva used to use ganja, bam bam bole, and there's a lot of medical articles and personal blogs which say that cannabis has medicinal properties. But we practice evidence-based medicine. And in evidence-based practice, we follow a hierarchy of articles that are used. And as you can see in this pyramid, the topmost and the most valuable or of highest value is for randomized controlled trials, RCT. Personal anecdotes, personal experiences are way down the pyramid. So, the FDA, Food and Drug Administration of the United States of America, has not approved cannabis plant for any medicinal purposes. But they do have approval for certain drugs which contain purified forms of cannabis in controlled forms. And right now its efficacy is only for chronic pain or for cancer patients who are on chemotherapeutic drugs and are having increased nausea and vomiting, to control that, and for some atypical forms of uncontrollable seizures, also for HIV patients who are having loss of appetite. That's it, not for any other purposes. And when it comes to the use of ganja, the use of marijuana for psychiatric conditions, as of now it's in a very nascent stage. It's too early to comment on the uses of cannabis for anxiety, insomnia or depression, be it psychosis or any other conditions. And it is premature to recommend marijuana as a form of treatment for any of the psychiatric conditions. Coming to the last part of my talk, the treatment. Yes, treatment is available, and mostly for intense forms of cannabis-induced psychosis and amotivation syndrome, we prefer drugs more than therapy. However, along with medications, if we have to bring a patient out of cannabis dependence, we also need to do what is known as counseling or therapies. We use motivation enhancement therapies or individual therapy, etc. So the take home message is, if you see an individual around you, maybe a friend or a family member, who is missing work, who is showing a decline in his academic performance, who is withdrawn to self, who is not the same and is acting in a very suspicious manner, please take him to an expert, because this could be because of cannabis use that you are not aware of. I hope this video was useful and informative, and if you have any doubts, you can direct message me on Instagram or even put some comments under this video. Please do like, share and subscribe to my channel if you haven't subscribed. Mental Health for All.